Good evening, everyone. I'm Robert Berman, and I welcome you to our COVID Task Force Town Hall meeting. In Zoom style, our meeting is interactive in that Monica will be fielding questions via the chat box. Monica will then relay the questions to the panel. In September, I asked Dr. Al Cohn and Dr. David Ashkenazi to form a task force to create a pandemic response policy. When I asked Al and David, I truly did not know what I was asking of them. Al and David enlisted the assistance of Dr. Julie Wolfson and Dr. Adam Kessler. Rabbi Wright and I round out the task force. Resources for the task force include the Jefferson County Department of Education, Infectious Disease Societies, the UJR, as well as Temple membership. So there's been a tremendous amount of work that's gone into this, and I will turn it over to David.
Thank you, Robert. So what we're going to talk about today is the following. I'm going to review why it's so important that we have a task force and a policy. Then I'm going to hand it over to Julie and to Al, who are going to talk about the tiered approach that we put together, the metrics that we will follow, and the criteria that we'll use to assign different levels. Adam's going to talk to us about the mitigation strategies and the what-if scenarios that we've come up with. And then Monica's going to talk a little bit about what is currently happening and what is planned for events here at the temple in the midst of a pandemic. Rabbi Wright will provide a message, and then as Robert mentioned, we will do a Q&A panel. So why do we need a pandemic task force? Well, as we thought about what the objectives were for our group, one was to first develop the processes and procedures that Temple needs to form and plan a good response. We needed to have a process where we could monitor and track and determine the metrics that we're going to use to make decisions. And then we needed to know that we're going to need there's going to be the need for updating this plan. So we need to consider ourselves as a plastic moving task force with a playbook that may need to change as we go forward. Our job is to make recommendations to the executive board, who can then determine policy and communicate that to the staff to execute. As Robert mentions, when we put together this task force, we recognized that we were going to need help from other members of our community and beyond that are listed there. So why do we need a pandemic policy? Well, I think it's very clear to us that we have to get this right, because we have two different things that kind of potentially can conflict one another. The first being that as a temple, our mission is to engage, connect, and inspire people through Judaism and spirituality. Although we're grateful for things like Zoom and emails, we all recognize that face-to-face communication is optimal. And so how can we do that is a really important question. Alternatively, it's also very important with what's happening out there that we keep our community safe, especially because our temple is made up of many who are the most vulnerable. So how do we engage, but at the same time do it in the most safe way we possibly can? There is a tremendous amount of information out there. There's a tremendous amount of misinformation. Many of us have really kind of revisited things like contacts and things like tests and PCRs, and there's lots of different information out there that we needed to sift through. There's also misinformation that many of our congregants have access to. We also emphasize that this information is going to change over time, and we need to be plastic to our policies. Finally, it's important that we all recognize that this pandemic evokes many emotional opinions, frustrations, and challenges. And so we really need to have a plan and a playbook in place to deal with the concrete stuff so that we can also deal with the emotions and the opinions and the frustrations and challenges. We need to provide clear communication to everybody involved. We need to speak the same language. We need members of the temple to know what's happening. We needed members to know what to expect as we move forward. And we need to have a way that the staff and the board communicates a clearly articulated plan that's not providing mixed messages to the community. So with that, I'm going to hand it over to Al and Julie, who are going to talk to you guys about specifics about this policy as it regards to the tiered approach. Julie?
Thanks, Dave. Thank you, David. You can hear me, right?
Yes.
So Al and I are going to walk through the details of the policy and try to keep it as clear as possible. There's a lot of information and we'll try to lay it out, but there will definitely be opportunity for questions and answers, questions at the end of this. So big picture, that we're taking a tiered based approach to all activities at Temple. And we've based this on vetted guidelines that have been vetted nationally and internationally so this includes the World Health Organization. The WHO has guidelines on mass gathering, COVID-19 risk assessment, and they have a tool for religious events. The CDC has considerations for communities of faith. And then the Alabama Department of Public Health has guidance for K-12 schools, including the ADPH Back to School Toolkit, but they also have guidance beyond the schools as well. And what I know that Robert mentioned in the beginning that we have some experts and consultants that we're working with. In general, what has happened, just to let you know before I show you the details, we did, before this was presented to the board, we also sent this to the Jefferson County Department of Health to review, and we vetted this as well with our congregants who are infectious disease experts, such as Dr. Sag and Dr. Friedman. And so thinking about what we're using to determine risk level, we're using a number of things. So the Alabama Department of Public Health metrics that represent county level infection are playing into this, and I'll walk you through that in a second, as are the infections that are associated with temple activity and the ability that we have as a temple to implement 5 key mitigation strategies as per that WHO risk assessment tool. And Al's going to walk us through that in a minute as well. And then finally, consideration of the CDC metrics identified for school reentry. So let's take these one at a time. Oh. And of course, the temple needs resources and facilities is very key to considering all of this together. So taking these one at a time, first we're going to think about how do we assign and move risk level.
I'm sorry.
That's okay. How do we assign and move between these risk levels? So the task force makes recommendations to assign a risk level, and we'll be taking into account the temple preparedness to mitigate the impact of COVID-19, and we'll also be taking into account community level infection risks that are related to the virus as well. And in determining the level of operations, we felt it'd be important to point out that every attempt is going to be made to provide recommendations that sync all 4 categories we're going to show you, but it may be necessary at times for one or more to have unique recommendations in terms of risk, and this will make a little more sense when Al walks you through the details of it. But the task force as a whole, to reassure the overall plan, is we're going to track metrics on a weekly basis, and this is very much a living document and a living plan, and that we're going to be absolutely reconsidering all of this as we go very frequently. So now taking this step by step, when we think about the ADPH metrics, so what they do is they use, at the State Department of Public Health, they use data-driven metrics to look at the risk of COVID-19 spread in the community, and then they determine a risk category for each county. And so here we're showing you a map of what it looks like right now. And so this ranges from dark red to orange, yellow, and green. And this has a very high risk to low risk, right, and in terms of a spread. But how do they determine that? And so if you click the next, David, so these are the metrics they use to determine those color levels. So one is they use the percent of positive tests among the tests that are performed. And so they look at the number of days this is declining, or if it's less than 10%, is it stable and less than 10%? And so that's the top little black box that you see here. This is a snapshot of what this dashboard looks like and where they show us the metrics. The second thing they look at is, are counties actually testing enough? Are they meeting minimum goals that the state is setting for how much testing is done? And so that's the second black box that they show you. And then is there a decline in medical visits for COVID-related symptoms? And that's the bottom black box. And all of them are tabbed along the bottom of the site so that you can look at what they each look like. And that's the percent positive that we see there. And then on the next slide, I'll turn it over to Al so he can walk us through the next piece of this.
Yeah, thanks, Julie. So just as a little bit of a just 10,000-foot overview, and just to sort of back up, big picture here, none of us have ever written pandemic policy before. And so this is really sort of was an effort at figuring out where the existing resources were for people that have thought through how to keep our temple safe. We have access to a compendium of other Reformed Jewish temples who we communicate with. What are they doing? What are their policies looking like? What is their reopening policy looking like? We have, local and regional resources that are we're bouncing this off of. And one of the biggest tools that we found that just sort of helps guide religious organization is this title at the bottom of this slide, the World Health Organization Mass Gathering COVID-19 Risk Assessment Tool, which essentially is a really big document that uses, that has this colored graph at the end of it. And essentially what the document seeks to do is it sort of tries to stratify the risk of the event occurring at the religious organization. So on the left side, that far left column, you'll see a total risk score. And essentially what you do is you look at the event that your temple or your church is having, and you answer a series of questions. Is it primarily indoors? Will it have people over 65 there? Does it have a bunch of international guests coming? And there are a variety of things that will give you a point. And really, it doesn't take very many yeses. For example, if the event is indoors, for example, if the event is occurring in an area where there is high spread of the pandemic, those are 2 points right there. If you've got people over 65, I mean, it's really easy to get 3 quick points with just sort of the event, especially if it's an indoor temple event. So it's really easy to find yourself in the moderate high risk, number 2 and number 3 there on that far left. The rest of the document is a really large series of questions that seeks to ascertain the degree of preparedness of the individual organization. And even though I think that we are all feeling like we're doing things, that we're being safe, and that we're really trying to be thoughtful about our degrees of preparedness, at the end of the day, we're still working through this. And just without even boring you with the details of that document, let's just presume for the sake of argument that our temple is in the somewhat prepared or somewhat unprepared, that like middle zone there. And if you look at the 2s and 3s, and if you look at sort of the colors in that area, it's really easy to find yourself in these red, oranges, and yellows there in the center. So don't read too much into this, except to know that these are the colors. David, can you go back for one more second?
All right.
Those colors here are going to be the same colors you're going to see on our colored tier response to the temple. And what we tried to do is, yeah, David, if you'll fast forward to the tiered system, we've sort of taken the temple and sort of thought it through in 4 different sort of categories. There are things like our sanctuary use, like how Shabbat looks, how the temple sanctuary operates. We've got a school system with Hebrew school and Sunday school kids that need to be thought through separately. We've got just the activities and the business of running the temple, and can we deal with funerals and life cycle events and the business of the temple's day-to-day, in addition to like mitigation strategies that might also at the top be adjusted depending on what sort of color code the temple is in. And really what it is, that World Health Organization document is really meant to sort of show you that it doesn't take a whole lot for us to find ourselves in an orange category. I mean, like you have to answer yes to like 2 quick things, like is it an indoor event, and is it in an area where there's a lot of coronavirus, and you're already in an orange zone there, regardless of the temple's preparedness. And as Jefferson County, as the counties that we're on those maps that Julie showed you, as Jefferson County and as surrounding counties and as the data surrounding us move into more favorable colors, when the Jefferson County is green, that'll correspond with our yellow here on this tier. When Jefferson County is orange or red, that corresponds with sort of our orange level there. And then, you know, if there was like an outbreak in Temple on top of the orange issues, that might sort of force us into sort of like, you know, red sort of considerations and things like that. We are currently, based on that data, we sort of think about the Temple in its current form. That's fine, David, in the orange zip code. And just to sort of drill down on this, let's just look at the sanctuary here for a minute. So in that second sort of row there where the sanctuary is addressed, you know, right now, even if we wanted to sort of move into the yellow tier and we wanted to open up the Temple and do some more opening, you know, first of all, just the numbers in the state are moving up, and it feels just questionable because the national and statewide and regional numbers are all moving in the wrong direction to feel like it warrants loosening of the reins. One of the critical features that David sort of addressed and that Adam is about to address is before we feel like we can move into yellow zip code kind of conversations, we've got to feel comfortable that we can handle the orange sort of terrain, that we know how to handle mitigation issues, that we know how to take care of things when there's less traffic in the building, so that when there is more traffic, we are in step and we know what we're doing. And if you look at the sanctuary for Shabbat, for seating, you know, right now we're not doing signups. It's not Shabbat as usual. And even though there are churches and people all around us that are on sign up geniuses where you can sign up for a group of 4 and things like that, which is certainly where we would love to go in the yellow sort of zone. Right now, with the numbers that exist in Alabama and Jefferson County, and just sort of as the Temple sort of digests how successful we are at our own mitigation strategies, we find ourselves in this orange as needed kind of, you know, realm. And, you know, if you look at the school components, Linda has been plugged into this conversation from its onset. All of the issues that are sort of existing in the orange sort of school sort of column there, those are all in line with sort of what's actually occurring. And the Temple sort of feels like right now we are working to make sure that we can safely operate in the orange world right now. As the metrics that Julie mentioned that are sort of Alabama public health metrics that are taken into account with CDC recommendations, that are taken into account with Mountain Brook school system recommendations, are taken into compendium, you know, this task force will sort of continue to look at, and also at like how well we're doing tracking our orange zone. Like, are we providing masks? Are we able to do what we say we can do in the orange zone successfully? And if so, as the numbers in the state continue to move along and we feel like we've got our act together in the orange world, then we'll move along to sort of trying to, you know, open up into the yellow world where maybe we can have more people in for Shabbat services. We can do sign up geniuses and have family units sit together in spaced out areas. You know, we still are having people who are, you know, have lost a loved one. If someone needs to come in to say Kaddish, there are conversations that are occurring where the Temple, on a clergy approval sort of, you know, pandemically appropriate manner, is still being utilized. And the place is still in existence. It is functional, but it's on a far more limited scale than, you know, we hope to graduate to. And the orange and the yellow, I think, are sort of where we are now and where we hope to get to as the Alabama numbers continue to improve. And I'm sure that there'll be questions about all this, but this was sort of essentially this tiered system that was meant to have language that was open-ended enough that allowed for dialogue and individual considerations to be made for specific, you know, instances, that wasn't super rigid, that allowed for the plasticity that David was referencing, and that just allowed for us to at least have a playbook by which to direct rules for all of these different aspects as we move into different risk tier groups. And I think that that's it. So yeah, I'll hand that off to Adam to sort of give a little bit more about our mitigation strategies as well. And I'm sure we'll come back to this.
Thanks, Al.
Yeah.
So yeah, I'm going to talk about mitigation strategies, and a lot of these are things that we're already doing in the community. And these are things like wearing masks. Masks are going to be required inside the temple at all times. The only exception is if one of the employees is in their own office or small room by themselves. The use of hand sanitizer, of course, will be encouraged and made available at the entry and at strategic points throughout the synagogue. Prior to entering temple, all individuals will undergo some screening for signs and symptoms. You'll be asked some, basic questions like you are maybe at other places in the community, especially hospitals and whatnot. You'll get a temperature check every time you come in. There will be the expectation that there will be physical distancing, just as there is, or that we're trying to have throughout the community, of 6 feet or more. Except if we are going into the sanctuary, family units will be allowed to sit, of course, with each other, so we don't have to physical distance in that specific situation. The entry and exits will flow in separate directions. The ushers will be trained on how to help with this and to help communicate the mitigation strategies and possibly help enforce that, usually with just a healthy reminder. There will be plenty of signs around temple regarding these issues. We will have limited amounts of touching of written materials and avoiding ritual touching of common objects, which includes, kissing of the Torah and drinking from different objects, the wine glasses, etc. And there will be enhanced cleaning that will take place as appropriate with approved cleaning agents. So what if a congregant tests positive? Well, this is probably going to happen, but the Temple Emanu-El staff or the appropriate people will evaluate the situation specifically. They will inform close contacts within 24 hours. And some of this we'll be able to do this because once people start coming into the sanctuary, we'll kind of know where everyone's sitting. And what is a close contact? Well, anyone sitting within 6 feet of someone who has a confirmed case for 15 cumulative minutes within a 24-hour period. And I just want to mention, we're getting all of this really directly from the CDC. We're not making any of this up. This is really coming from very strict vetted guidelines that are already in place. And so again, we'll let you know if you have been in contact with someone, and then we will recommend that you get quarantined as soon as possible for that 14 days from the day of contact. Of course, we are not going to be a substitute for your primary care provider, so we'd ask that you communicate with your primary care provider to get further guidance. But just kind of going through further what ifs, if you develop symptoms within that 14-day period, discuss these with your physician. And if you do turn out to become COVID positive, we'll ask you to just notify Temple so we can let others know as well. We can go to the next slide, I believe. So when can you return to Temple if you have had a positive test result? And this is for congregants or employees. This is, again, pretty standard for most workplaces at this point, that you can return when all 3 of the following have been met. And this is based on time and symptoms. So 1, you have had at least 10 days since the COVID testing was positive, or at least 10 days have passed since the first symptom started, and at least 24 hours have passed since the last fever was documented, and other symptoms are improving. So it should be noted that these conditions don't change if the individual has been confirmed positive and then subsequently had a negative test. We're not going on a testing strategy. It's really once it's been determined that you have COVID, or you've been in contact with someone, it really is a time-based strategy on when to return. So that's very important because, people will try to get kind of around the system, as it were, saying they've had a negative test, but that just really doesn't really work out well. I think we can go to the next slide. sorry. So what if you had symptoms but were never tested? When can you return? Well, in the event that an individual had a suspected infection, for example, developed symptoms that were very consistent with COVID, and maybe had a close contact but was never tested, we're kind of going back to the same type of approach as before. We're asking that you wait at least 10 days since the symptoms first appeared, and to wait 24 hours since the last fever without any fever reducing medicines, and all your symptoms are overwhelmingly improving. And I think it's really important to say that, you know, we're doing this in a with strict privacy and other considerations like that. No specific medical information will be given out. It's only the appropriate staff and task force members who are involved in this contact tracing will evaluate the situation and will be made known about these things. Any data tracking will be maintained in a password protected document, password protected secure server. And so, you know, everyone is not gonna know that you tested positive, as it were, or anything like that. So we take this very seriously. Everything will be kept private. And I believe that's where I end.
Monica.
I'm here. Okay. All right. Thanks, Adam. So during the pandemic, we're staying engaged. We are trying to create spaces where people can be together virtually and slowly in person with appropriate social distancing. So we're keeping all these guidelines in mind as we move forward to create those spaces to where people can connect within our congregation. On the screen are just a few of things that you can currently get involved with. There's much more context, or there is more context to a number of these programs. So I encourage you, if you are able, you can message me on here or reach out to me at Temple. I would love to tell you more about them. You can also look at our website, ourtemple.org, or on our Facebook page or our Instagram. And of course, your monthly bulletin holds a lot of these programs. So some of these things are brand new and they are coming soon, such as connecting with Rashine and the virtual talent show, but stay tuned because that information will be out there. So we can go to the next slide, David. Of course, we are going to do Feeling Guilty. It'll be a little bit different this year. That information is coming out in the next week. Instead of having the Christmas store, which we have helped supply with Temple Bethel and Trinity United Methodist Church, we are doing kind of we'll say a Hanukkah angel tree, where there will be about 145, 175 kids from a school on the West End. It's actually right across the street from Urban Ministry, which is our partner organization for Feeling Guilty. And you will adopt a child, get their wish list and buy the gifts for them and bring those gifts to Temple. And then we will take it to the school for them, their families to pick up. So that information will be forthcoming. And let's go to the next slide, David. And then of course, we're gonna have an awesome Hanukkah celebration Saturday, December 12th at Homewood Patriot Park. It's a lovely big park in Homewood, lots of parking. And we have reserved Heavenly Donuts. So the food truck will be there serving up donuts galore. And of course, we'll do Havdalah and other wonderful Hanukkah tunes. And it'll just be a nice opportunity to be together with your fellow congregants. So that's just a few things of many, and I hope you will continue to stay connected virtually with Temple on its many platforms, because that will be the best way to see everything that we have coming. Thanks.
Rabbi.
I guess I want to take this moment quickly just to give us some Jewish teaching. We've been hit a lot with a lot of science. I thought it'd be fitting to give us some words from someone who just passed away, arguably the greatest Jewish thinker in the modern period, Rabbi Jonathan Sacks. And I think this teaching really fits perfectly what we're all experiencing, is that faith does not mean certainty, It means the courage to live with uncertainty. It does not mean having the answers. It means having the courage to ask the questions and not let go of God, because God does not let go of us. It means realizing that God creates divine justice, but only we, acting in accord with God's word, can create human justice. And our very existence means that this is what God wants us to do. And even as we continue to wrestle, I think yesterday was nearly a record day of COVID positive tests. We still do our mission as Jews, is to face the uncertainty heads on. It's having the courage, and even while we're still in this unusual realm, we're still there for one another. Thank you. I see two questions. I'm not going to say the name. The first question is there an opportunity for some other grades to do other outdoor classroom versus virtual? It's a great question. The main issue is that I know I'm speaking on behalf of Linda, and hopefully I'm getting this information correctly. We have teachers, other teachers in our school who do not feel safe teaching weekly for exposure risk. And on top of that, it creates a significant logistic challenges of setting up weekly outside religious school for so many grades with the personnel that we don't have. But the heart of the matter is that teachers do not feel safe doing Sunday school curricula and Wednesday Hebrew school. The other question is that it seems that other places of worship are having in-person services. That is true. I know that Mountain Brook Baptist is having services. Some are doing online. I'm going to defer to the task force here. I think those could possibly change in light of the numbers, but
yeah, can I jump in on both of those? Hey, David, will you go back to the tiered sort of slide just that has that there for us? So with regards to could other schools or classes have more outdoor opportunities, the short answer to that question is from a rule standpoint, from what we've got set up with the pandemic, the answer is yes. And the idea is we are trying hard in this orange zone to really, have very small groups that are outdoors, that are well spaced out, and that, abide by the type of precautions that you would expect in the orange sort of zone. And the logistical issues involved with whether or not teachers feel comfortable, whether it makes sense from the teaching materials and those type of things. I think that the Temple leadership is largely going to look to Linda and the school board to actually make determinations for what the best types of gatherings are for those specific groups of students. It's the task force plan from a communication standpoint to not just have this meeting with the general Temple, our Temple family as a whole, but also sort of see if we can't drill down sort of with the school parents so that we can really sort of focus on the impact and issues related to the modification for the school system as it relates to these as well. And I think there's certainly dialogue to occur as the weeks and months play out with, how to be thoughtful about, the different grades and how to teach them. But from a permission standpoint, the COVID task force would not have problems with, school groups having small spaced out, sort of groups on occasion or being done in some of the smaller age groups where it's just not appropriate for a kindergartner to be able to be expected to watch a Zoom sort of classroom. It's just not appropriate. So those will be things that will remain in dialogue about. And really for the purposes of this, it's more about the permissiveness of that more than it is, do we want that to occur? So we would encourage additional dialogue with Linda, with those teachers to sort of better understand logistics and issues that go into that. And as it relates, what was the second question, Adam? It was something about...
It was about other faith organizations have.
Oh, right. Yeah. So, our totally desire is to sort of get this place up and running. I mean, that's the task force desire. to do that. I mean, I think that we have now finally, as of this task force document, have given thought to like what that would look like, and we had not really even gone through the logistics of what opening up looks like for us. Do we have all the things in place? And I think that we really do start to feel like that we've got what we need. The Temple staff is doing an amazing job with regards to the mitigation strategies. I mean, you can't get in the front door without William zapping your face with the temperature checker. And everyone is really doing everything that the task force would expect of them at this point. It just feels irresponsible to, even though we are doing everything correct in the orange zone, it just feels irresponsible when the state and the nation are peaking with new cases to even give consideration to like making things more relaxed. It just feels inappropriate from a temporal standpoint.
We have another question regarding during the high holidays, we had the choir, and how do we assess that risk? I can say, and then the task force can say, the choir had state-of-the-art singers masks that caught all of their singing, and it was safely measured out with 12-foot radiuses, and it was a once in a lifetime just to provide a high holiday quality experience. Task force, do you want to answer anything to that?
I'll refer everyone back to this tiered system. I mean, if you look in the sanctuary where the choir is, I mean, it's going to be in the orange zone, very limited. So it's not going to be something we're going to be having every Shabbat. Temple staff, temple leadership, the clergy felt like it was a really critical component to our high holiday experience, and felt like the way that it was done in terms of spacing, in terms of not having other congregants there, that it really was a reasonable risk mitigation for both the staff and those involved there. So if you look at this tiered system in the orange category for a sanctuary and go to where it says choir, in this zip code, in this orange zone, it's going to be very limited. We hope as we get into yellow that we can open that up and be less than very limited and just be limited about it. But it's just not something where we're putting a bunch of outside people singing at the top of their lungs in close proximity with one another. That feels like an unnecessary risk, except for on very specific occasions. And the high holidays was felt to be suitable for that sort of acceptance.
And do you mind if I add one piece, Al, because the question was, what do we know about masks? And I'll say the most recent data that I've seen is a paper that's from July. And I think we're back to the point of the fact that this is a living and breathing document and policy, and that we'll continue to assess as we go, right? We know that it's spread by aerosol and that masks help. And I think when you look at this singing and masking, really it's like a cantor singing or a choir singing in a short period of time and space is a shorter exposure. Whereas if we had the whole congregation singing, that would be a different consideration, right? And very, very different in terms of compared to what Al's talking about. But I think we'll keep an eye on everything, and if anything changes, obviously we'll move with that. But I think we're really listening to what the known risks are at this point in time.
And just even to sort of, there was another question on there about sort of the vagary of like strict and very strict and limited and very limited. And the idea was to allow this document to sort of have some breathing room so that this was essentially a playbook that didn't pigeonhole the temple into thinking through a Shabbat service 4 months from now, or just, it didn't pigeonhole us into not being able to address, real issues and real events in an empathetic and thoughtful manner. This is really just sort of a best effort here. If there was something that came about that we felt like we wanted to bring in the choir for, I mean, I think that the temple would have the ability to think through the risks and benefits and sort of all those things. And these very limited and these sort of vague phrases that you're seeing there hopefully allow the clergy, hopefully allow the task force some guidance with sort of what the task force, vibe is with regards to permissiveness of these things, but also allow for things to just this to be a living, breathing document a little bit.
Question for the doctors. Once we go to yellow and there is a positive in the sanctuary, will you notify everyone else just to make sure that, let's say they weren't sitting 6 feet, if they can monitor for symptoms?
No. So the people who meet criteria, we decided specifically, if you are within 6 feet for 15 minutes or more of a person who the temple finds out is positive, you'll be notified. But just because you were in the sanctuary with a person who was positive, the degree of risk associated with someone who is outside of that sort of 6 foot, 15 minutes within 24 hours would not prompt us to notify every single person that has been in the temple. What the task force did agree with, though, is that we wanted to be really lenient with those guidelines. And if that we thought anyone was a reasonable risk for coming into contact with someone who might have put them at risk for developing COVID because they were positive, we're going to know where people are seated. We're going to have recordings of this, and we're going to take a very lenient stance on who should be notified, so that we're wanting to provide privacy issues. We're wanting to not be alarmist and let people know about, not tell people that they have things to worry about when they don't have scientific reason to worry. But also, if you are someone who has even a reasonable degree of risk associated with an exposure, the task force has acknowledged that, we wanted to be lenient with what we called exposure, even amongst that sort of guideline.
And if I may, remember, we're all going to be wearing masks as well. So there will be further mitigation. So that's another reason why we didn't feel it was needed, because we'll all be wearing masks.
I mean, we're talking about here, when you're leaving the temple, that people are leaving in groups. This is not going to be gathering in the sanctuary to sort of hug and kiss. We're going to let people go in an organized fashion. We're going to try to control how people enter the building. We're just, there will be a sequential sort of manner that how this occurs before things just get back to normal. And we hope that we really can get there soon. I mean, I miss being in the temple. I miss my Temple Emanu-El family. I think we're all in the same boat, but we're just, there's just not a way to force the numbers in the state and our county to be different than the reality that they are right now.
Another important question. We have about 70 participants, and let's say we multiply that by 2, and we're still missing a large number of our temple families. How will the temple communicate this really thoughtful plan so more people can know about it?
Yeah, I can take that one. I think we need to do it on multiple levels. I think we need to provide this recording to everybody that they can listen to. I think we need to, highlight this mitigation plan with this tiered system and communicate to everybody where we are at different time points. We're currently in orange. When we change levels, we'll need it to kind of have a very strong effort to do that. Our policy will be available to anybody who needs it, and in the website as well. We should probably continue to have these task force. It's been recommended to me that perhaps we should have a similar task force with parents of children who are attending the school. A similar town hall with parents, and I think that's available as well. So we need to communicate on multiple levels to everybody, because it's really important that everybody understands what's happening.
How good are the tests? And I think the reason, just to back up exactly what Adam said, the reason that we consider that first test to be a real positive, no matter what it was this a rapid test? Was this a PCR? Without getting into the details, those rapid tests, 50% of them are going to be a false negative. And so if you have 100 people that have a COVID-19 infection, it's only going to pick up 50 of them. And even those great PCR tests that we have, out of 100, it's still going to miss 20 to 30 of them. So in an environment, what the CDC says is that in an environment with a high positivity rate, and we really do qualify as a high positivity rate in Alabama and in Jefferson County right now, you have to consider a positive as a positive as a positive. There are situations you might hear of where they might call it a false positive, where it's like everybody that walks into Warner Brothers is getting screened every day and they're doing thousands and thousands of tests. And that's a very different situation.
Like the purpose of this task force was to try to think through an objective rule book that sort of just feels applicable and that is implementable and that has scientific merit, is the basis for decision making. And while the tests and things like that, I mean, none of the, once upon a time with the pandemic, whether things were considered high risks or low risks were sort of depending on whether you had a mask on or whether you didn't have a mask on. And just sort of like the science and understanding behind the pandemic are evolving to the point where there's just not so much a role for this testing as a manner of controlling it. It's a little bit more temporal right now. I mean, please, other colleagues, correct me if I'm wrong, but you have to sort of allow in order to keep people safe because of the risk for negative tests and the ability to still, make someone sick, you have to allow the time to pass between these positive.
And Al, just to clarify one thing about the testing does not tell you if you're contagious. The testing tells you if you have any broken down little particles of COVID. And so if I could be positive, even though I had the disease a month ago and I haven't been infectious now for 2-3 weeks, and you could still remain positive. So it doesn't really tell you if you're contagious. It just tells you if there's any tiny particles, which may or may not be infectious and contagious at the time, if they're still kind of part into your blood system.
Right. I mean, to what you're saying here, David, is really that while not being able to test negatively may prevent someone from coming back to Temple as soon as they want to,
Correct.
But what you're also saying is that you don't have to risk testing positive and really not being infectious, and you really could theoretically be a part of Temple life once we get to this point, even if you have a positive test, because enough time has passed where you're not infectious, despite the fact that you might have tested.
I'm about to ask another question. I have another question. Once there is a vaccine, what effect will the vaccine have, and what is the critical number of vaccinations needed to reopen?
I think that this is where we have to be plastic to what's happening, and I think it's way too early to try to address that right now. I think it's a really good question, and I think it's something that we're going to keep an eye on for sure. And as that becomes part of our way to deal with COVID, we will implement that and think that through in this group and communicate that to the Temple.
And if I had a crystal ball, I would say it's probably going to end up being, how does the vaccine affect our community infection rates? But that's a crystal ball, right? We'll wait and see how things go.
But it's exactly part of the unknown future of what the pandemic is, that this task force expects to sort of have, the need to remain in active dialogue so that this document can be adjusted to reflect whatever the scientific reality is as imparted by the vaccine whenever it actually is part of our vernacular.
I believe we have answered all of questions. Do we have any more?
So
I was just going to
Go ahead,
sorry,
Julie.
go ahead.
Julie,
I was just going to answer. There was a question in the chat about people being tested more than once, and I'm trying to find for you where it is, and I can follow up with you individually, but at some point along the way, the state started reporting just one test per individual infection, and so they have addressed that. And early on, that was not the case, but they have shifted that. So I think that should answer somebody had a question.
But even if it didn't, that probably was not
Right.
a bulk of the positive tests. So
Exactly.
I would take those numbers and really
In good faith.
Exactly. Thank you.
Yeah.
Another question. When will the congregation know that the tier color has changed?
Yeah,
good question.
Good question.
David.
Yeah, I think we will notify everybody in as many mediums as possible where we are and any changes that occur, whether they go from kind of orange to yellow, or if down the road we need to go the other way from yellow back to orange. That'll be something that we will be communicating. Our hope is that having this type of a picture will help everybody understand what we're talking about when we say we're going from yellow to orange. But we will do that in as many ways as we possibly can.
I was just going to sort of offer also to everyone that, the temple really, I mean, when I am on listservs with other URJ congregations, this type of comprehensive tiered sort of thing that we've got here is so far and ahead of what some of our similar congregations and even congregations who are larger than us have. It's really, we vetted this through the Alabama Department of Public Health. We vetted this with Mike Sagg. We vetted this with anyone that we could think of before we floated this to the executive board and to now our congregants. And it really just had a lot of very positive feedback in terms of its plasticity, in terms of its comprehensivity, in terms of the science that sort of bases it. And so while I think that there is a lot of frustration, even amongst the task force members, about just how frustrating it is to not be normal at the temple, I hope that everyone will feel good knowing that there really has been a lot of thought into this this pandemic sort of policy, and that it's a work in progress, and that if any of the congregants had feedback for how we could make it better, or for things that we left off and things that we didn't think of, it's all sort of uncharted territory for us. And so we're doing our best to ask, our colleagues and to sort of make sure that we're bringing the correct information to our congregation. But it's not, it's an unprecedented problem. And so as we think through this, I'm sure that the task force, will miss things, and there will be missteps, and there will be frustrations as we try to navigate, amongst the tiers. So just an open invite from anyone at our temple to provide ongoing feedback, and that this task force, this town hall, is not the only opportunity to dialogue about this. This will be a living, breathing policy that will be expected to change as the pandemic sort of brings new information. And just, I can speak for every one of the task force, members, that we remain in very interested, willing dialogue with anyone that feels like they've got additional questions or insight or things that we need to be addressing. And we're happy to hear that.
Couple new questions came up. There's a question about, it says, it sounds like the task force is very okay with more outdoor classes. So what will the next steps be here? Yeah, so it's important to recognize that the task force does believe that outdoor classes are very doable. And we will, provide that to the temple. But we're not the ones that are going to actually coordinate the classes. And so that'll need to be go back to the school. And as Al mentioned to Linda and the school board, and to have that dialogue and conversation about when can we do that? And if so, how are we going to do some of the things like making sure we know who was there in case there needs to be, contact tracing done at the other side. So that needs to be, go back to the independent part of the temple, which in this situation is the school. And then there's another question. It says, sorry if I missed it, but have you all evaluated the risk of outdoor gatherings, such as placing a large tent or canopy on the parking deck? Anybody want to answer that?
Yeah, I'll field that. I mean, it's something also, again, that we remain open-minded to. It's just sort of situationally, and in the same way that high holidays when we had to do tashlich at the river, and that when we're doing, certain events that just to provide the services that our temple sort of provides, there are going to be opportunities where we're going to want to congregate despite the pandemic. And so thinking through outdoor gatherings, how to space people out, is it appropriate to have that on the parking deck? I mean, all of those things are completely on the table. None of those issues have been scrapped in terms of options. I think that where the task force struggles is it's hard to feel right now with the numbers in Alabama as they are trending that it feels appropriate in any sense of the word to loosen guidelines right now. It feels like all the numbers are going in the wrong direction. And so right now we're focused on making sure that our mitigation strategies are all being implemented, that we've got everything thought out and ready to roll, so that as numbers in Alabama, ebb a little bit, that we'll be prepared to, do stuff on the top of the parking lot or whatever it is that the next step allows. What else?
Well, I think that it's 8 o'clock. We'll wrap it up. If there are more questions, please just feel free to reach out to any of us. I just want to take a minute again to thank the task force and primarily Dr. Cohn, Dr. Askenazi, Dr. Wolfson, and Dr. Kessler. The time and energy that they put into this, I'm aware of because I have the number of reiterations of this document that these guys produced. I mean, they were tireless and relentless in putting this together. And I certainly appreciate everyone joining us tonight, and I hope all have a great week. Thank you.
Good night.
Bye.
Good night.
Good night.
Good night, all.
Good night. Thank you.